The first step in preventing these injuries is becoming familiar with the risk and protective factors for these injuries. Risk factors are things that increase a person's chance of suffering an injury and should be avoided as much as possible. There is an entire category of risk factors called modifiable risk factors. These can be changed. Modifiable risk factors include things like low levels of fitness, including strength and flexibility, high workloads, including inadequate rest and recovery, and poor movement quality, or the way that an individual moves. A young athlete's fitness level plays a large part in reducing their risk of injury and improving their health. The U.S. Centers for Disease Control and Prevention, or the CDC, regularly reports on behaviors that impact the fitness levels of high school students. The CDC recently released findings from a study that found that the number of high school students who performed strengthening activities like push-ups or weightlifting exercises at least 3 days per week dropped from 55.6% in 2011 to 49.5% in 2019. Low levels of muscle strength is an injury risk factor that can be changed by performing specific types of strengthening exercises. The CDC also reported that the number of high school students who participated in moderate physical activity 5 days a week for at least 60 minutes dropped from 49.5% in 2011 to 44.1% in 2019. And that the number of high school students who participated in physical education at least once per week dropped from 31.5% in 2011 to only 25.9% in 2019. Low rates of physical activity and physical education can impact overall fitness levels and increase the risk of injury. But again, this is a factor that can be changed by meeting the national recommendation for 60 minutes of physical activity each day. The CDC also reported that the percentage of high school students who are obese, which is defined as being at or above the 95th percentile for children of the same age and sex, has increased from 13% in 2011 to 15.5% in 2019. When considered together, these fitness factors can contribute significantly as injury risk factors. The good news is that all of these factors can be changed. Fatigue resulting from high workloads or inadequate rest and recovery is another modifiable risk factor for injury. Researchers have found that muscle fatigue can lead to changes in movement patterns and body mechanics that increase the risk of injury, especially when performing jumping and landing activities. And once again, the CDC recently reported some very discouraging statistics. According to a recent report, the percentage of high school students who slept for 8 or more hours on a typical weeknight decreased from 31.4% in 2011 to only 22.1% in 2019. The fact that less than a quarter of all high school students are well rested is very concerning, but this is another injury risk factor that can be changed or modified. Some children use movement patterns that can increase their risk of injury when they perform skills like running or jumping. Finally, the way that children move when they perform movements like jumping and landing or changing speed and direction when running is the modifiable injury risk factor that we believe is the easiest to identify. Children should move with proper joint alignment, but parents typically don't know how to identify this risk factor in their child. This course has been developed to help you easily identify this risk factor in your child or children. To determine just how much movement quality is an issue among children, HSS researchers completed a study where nearly 500 children were observed performing several common movements and exercises, like squats, planks, and jumps. Unfortunately, these researchers found that only 21% of children between 8 and 11 years old, 29% of children between the ages of 12 and 15, and 21% of 16 and 17-year-old children were able to perform common exercises with their joints properly aligned. The rest of this course will teach parents to identify a common injury risk factor through a very simple movement evaluation. This common injury risk factor is called dynamic knee valgus. Dynamic knee valgus is the scientific term used to describe the movement when the knee joints collapse inward toward each other during activities like jumping and landing or changing direction when running. The photo on the right side of the screen demonstrates dynamic knee valgus. When someone's knees move into this knock-knee position, forces on the sensitive structures like ligaments and cartilage increase significantly. While some athletes are forced into this position by physical contact, many athletes suffer non-contact injuries, demonstrated in this video on the screen. Movement is an important aspect of everyday life. Proper movement patterns should be taught early in childhood to provide the knowledge and skills children need to participate in physical activity with minimal risk of injury. Unfortunately, improper movement patterns dramatically increase the risk of injury and limit athletic potential among adolescents. Let's watch that replay one more time, noticing the dynamic knee valgus as she changes direction.